Hi. You ever had that knee pain that's unrelenting, or just a nagging pain that you've maybe been told that it's bursitis? Hi, I'm Dr. John Gray, and today we're going to talk about different solutions for bursitis. Now, bursitis in itself, what is knee bursitis? Knee bursitis is simply a fancy word for saying that there's swelling in a sac that goes around between a tendon and a bone. Now, why does that swelling occur? That swelling occurs usually because of injury to a tissue surrounding the area, or because of repetitious use, and it's made worse when the repetitious use has bad mechanics. In other words, if that joint has some bad mechanics going on somewhere, even in the joint itself, in the knee, or in the ankle or the hip above it, that can contribute to that area getting more inflamed. That extra fluid will go into that sac and swells. So bursitis in itself is not really a diagnosis, it's more of a side result. So I want to talk to you about the three most common causes of bursitis. The first cause can be tracking issues. And when I say tracking, I'll show you here on our little skeleton. So in this area here, you'll see this kneecap and how it tracks. Now, when we say there's tracking issues, it's because it's either pulling too far out or going too far in and not riding in the center. It works like a pulley, so the more aligned it is, just like if you were pulling a rope over a pulley in the center, the more efficient it is. If it goes more to the outside, then it's less efficient. Well, what are some of those things that can cause that? There's a muscle group that hooks into a fascia on the outside called tension fascia lata, and that can get tight and pull that kneecap out. There can be muscle weakness on the inside as well that'll contribute to that. Something that most people don't think about is the foot, though. And when that foot flattens out, we'll show you in another picture, but if your foot is flattening out, what they call overpronation a lot of times, that will cause the knee to ride in like that, and that changes the angle of pull on that pulley. It also wears unevenly on the joint. So that's number one. Number two can be a simple, what we kind of connotated before, a muscle imbalance. And that can be weakness on the inside of the leg. It can be weakness in your bum muscles. And people say, well, why does the weakness in the bum muscle affect the knee? And it's because it's how you get up. If you can't get up from your hip or from your bum, you're going to flex your knee a lot more to get up and down. And that goes back to that repetitious injury or having bad mechanics causing inflammation. And the last thing that can be a common cause of bursitis is just simply tissue damage, especially in the cartilage or in the surrounding soft tissue like a hamstring pull or that's repetitious in that tendon, especially in the tendon area. Now, if you have cartilage damage, how does that occur? That occurs a lot of times when we simply take an impact that's too much for it, or we torque on that knee too much. And that can cause the connective tissue in between, that's really more of like a shock absorber, that starts to bleed, and that can bleed into the surrounding areas as well as the bursa. So our next video, we're going to talk about how to assess your ankle to see if you're getting proper movement out of the ankle. Because if you're not, then you're using it more like a peg leg, like the old pirate's legs, and that's going to really wreak havoc in your knee, cause extra inflammation, can cause the bursitis, but it can cause lots of other problems too, arthritis, and breaking down of the cartilage prematurely. So in our next video, we're going to evaluate your ankle, show you how to do some cool things there. And remember, if you like the video, don't forget to like and subscribe here at the bottom. And we will see you next week.